Hello, everybody. Thanks to my brilliant colleague, Olga, you all know the term social determinants of health. And Sandra Galea could hardly be a more gifted introducer of this term. We're going to pick up from where they left off with four people who are doing brilliant and active work in helping people's health by thinking about all of the upstream areas around them that you're all, I'm sure, very familiar with, because anyone involved with health spends the weekends, as my spouse and I did, writing grants in which every other phrase is social determinants of health. And right now, the hot social determinant is housing. And we have Laurel with us to tell us about the importance of housing and how so many health parameters devolve from housing security. How did you get into this?
So I kind of backed into housing, but love it. I was working in city government, which is, I think, the ultimate kind of way to experience all of these determinants at once, whether that's health, transportation, and other things. But thank you for having us here today. And we agreed backstage, there's not one that's more important than the other. We're all going to be part of a team. But just to speak about housing for a minute, I'm sure folks are aware there is an affordable housing crisis in this country. 19 million renters pay over half their income on rent, which means, as they say, rent eats first. Things like transportation, access to good food, childcare, and healthcare get compromised. We did a survey earlier this year at Enterprise where we surveyed renters nationally and found that 50% of them had deferred medical costs associated with a doctor's visit because they had to pay their rent. So this is just such an important synergy. I would also say the other way to look at this is a positive, which is we know that housing, stable housing, access to stable housing for families drives good health outcomes. So kids stay in school longer, people don't miss work, the rate of childhood asthma goes down. All of those things that I'm sure you're putting dutifully in your grant applications.
You bet I am.
And that we do too, are very much a part of that equation. So what we're doing at Enterprise is really thinking, how do we connect and elevate this important synergy? Because we're all gonna win if we can do this well together. And we've launched a $250 million 5-year campaign to bring health and housing together in a variety of ways, everything from capital provision to finance affordable housing, research to document best practices, and lots of other things to really try to bring that together in a comprehensive way.
So under specific administrations, the importance of this, for example, I'm thinking of the focus at the USDA on rural communities, building rural communities in all sorts of ways, and they put a big emphasis on housing. How are you finding now that you're able to get into the policy centers of Washington?
It's a really good question. I think this is just about showing up and reminding people. In particular, I spent 2 days on the Hill in the last month. Congress actually sees, good members, I think most of them see day to day the impact on their constituents of this connection. And so I think it's about showing them, you know, so-and-so lives here now, and this is what it means for them, and this business in your district is doing better because of that, right? There's lots of connections to show. That doesn't mean that it always translates into effective legislation. I would also add, while policy and government is important, we're finding really exciting partnerships with the healthcare sector and the private sector more generally. One of the things we're most excited about is a partnership we recently launched with Kaiser Permanente to bring capital through debt and equity funds into affordable housing creation and preservation. So you're starting to see, again, perhaps because of some of the dysfunction currently at the federal level, but you're starting to see a lot of innovation coming at the local level and at the state level. And I think the private sector is a big part of that.
Well, that's great. And one of the reasons I asked was because I happened to listen all day to a National Academies of Medicine gathering about social determinants of health just last Friday, which was really under the auspices of the Assistant Secretary of Health. And there was a full hour devoted to housing right at the beginning. Good. So I thought maybe HHS is really paying attention to
I think housing. They are. I think they are. It's always about resources, though, too, and bringing more resources to the table, and that's part of the challenge.
I guess that comes up in government.
It does.
Great. Well, thank you very much. Transport and getting to doctor's appointments and getting to and from places that can bring you to food sources. We all know about food deserts and work on food deserts. Robin, what are you doing with transport to help people overcome the problems of housing that can be remote from food and remote from medical care centers and community health centers?
Yeah, no, good point. Housing, nutrition, medical appointments, behavioral health, all of it. So I started a business with 2 other founders called Circulation. We built a digital platform to basically understand ride requests and then connect with ride options. So we work with Uber, we work with Lyft, we work with 5,000 different transportation providers across the US.
You're not just making that up. You're not.
No.
A lot of us say, well, 5,000. In fact, you mean 5,000.
I do. I mean, so we manage 67 million rides a year, and we operate in 48 states. And so to hit every rural area, as well as urban, across every level of service, someone needs door-to-door, they need wheelchair, they need stretcher, ambulance. The 5,000 number is real, but the sort of innovation we had on it was, how do we make all of these fleets look and feel like an Uber Lyft? You can book them when you want, you can see where the driver is, you can track them, you can do interesting things like geofencing and monitoring for stops along the way to reduce fraud. And so we built this business, we merged with the largest broker in the area, and now we serve a host of state contracts directly to get Medicaid members to
Just
enroll.
where I was going. So how big is the idea of public-private partnerships? Because you mentioned state contracts when we were talking.
So the market itself is about $6 billion. Little more than half of that actually is still funded by states directly, and the rest is MCOs or payers. And I know there's a lot of CareMore people in this room. No surprise, Medicare Advantage, they are adding transportation more and more. We've seen it for medical appointments. Now we see it for substance abuse programs, behavioral health, trips to the grocery store, trips to community resources, church programs, and the like. And so our goal is just keep moving. Members, we're actually taking a lot more providers out to the home as we see home care as an increasing trend. And then our next pilots are moving associated product with those members. Inevitably, they have prescriptions or DME or food delivery.
So you've reached the magic reimbursable threshold, which is quite great. Laurel, are you finding that in terms of healthcare providers or insurance that you've crossed into the golden land of reimbursement?
Not completely. Part of that is probably outside the scope of this shorter conversation because every state is doing things under the Affordable Care Act differently.
And Medicare Innovation, Medicaid Innovation.
Exactly. The connection between housing is clearer in some than others. It's most direct through something what we call resident services. So the kind of access to services like what Robin's talking about sometimes is allowed and sometimes isn't, right? And so I would love in an ideal world that it would all be connected, but we're not there yet.
Great. So the important thing to say about Chris Economos is she is my boss. So I am a senior lecturer at the Tufts Friedman School of Nutrition Science and Policy. See, I got it all right. Where I was just teaching this morning, and Chris heads my department, so I'm going to be especially nice to her, and I hope you will be too. Nutrition and community interventions. You've all heard, we're being a local crowd, we know of Chris's brainchild, Shape Up Somerville, which had to do with health altogether, but especially nutrition. And is that still an approach that's finding inroads?
Yeah. So let's first talk about the American diet, just so everyone's aware. We have a nutrition crisis in America, and we're falling short of consuming all the foods that we're promoting. So that's whole grains, fruits and vegetables, lean protein, low-fat dairy, and we're exceeding our intake of refined grains, salt, sugar, saturated fat. So we're in a terrible place in terms of what we're consuming, and as a result, we have an obesity and diabetes crisis as well. So just to understand that, it's probably one of the most meaningful things we could do is to focus on institutional change with respect to the food that we provide, children and adults and the aging population. In Shape Up, we looked at every environment a child moves through the course of a day. So they begin at home, they go to school, an after-school program, they may go to a restaurant, parks and rec. And we really transformed the food environments in each of those specific settings so that by default, they were consuming healthier foods. That's what we need to do on a national level. We have too many options that are poor choices, and we're expecting individuals with their own control to really choose what they eat and consume a healthy diet. We need to really reverse the offerings so that most are healthy, and then some are foods that we all like to consume, but we should be consuming
The
less
magic
of.
words of public health,
Yeah.
change the environment.
Right. So what we did in Shape Up is what we need to be doing nationally, and that is environmental and policy change that really transforms the offerings that are there. And that can be done through a whole suite of policies that we offer at the federal and state level. But I really want to make a plug for local action. Right now, more than ever, what we need to do is catalyze communities. And I think Garth is going to talk more about this as well, but there's a lot of power in a community, the citizens who live there, everyone who works in that community, leadership, and people who really want a healthy environment to live, work, and play. So what we did in Shape Up, we've been doing around the country, and it really takes will, political will, citizen will, to make that change. And from what I've seen in my own research that I've published and that I've spoken about, it's completely possible. We just have to have a mindset that that's our priority, specifically when we're talking about the 0 to 5-year-old population. When they can't make choices on their own, those are adult choices impacting children, and the consequences may be lifelong.
That's great. And let me put in a plug for all the work The Atlantic does on communities and the importance of community transformation. We're just starting a new series by James and Deborah Fallows, who wrote Our Towns, about the great local, in the trenches work that communities all over the country are doing. Just this week, they're focusing on Indiana. It's very inspiring. Yeah. Garth has carved out a reputation himself, thank you, Chris, among foundation philanthropists, that very grand term.
Thank you.
As someone who cares enormously about communities and about community transformation as it regards health. So what is some of the work you're doing that might amplify the work we've just been hearing about?
So I want to start off by recognizing the comment about acknowledging the strength in communities. You know, where I grew up, when I tell people I grew up first in Jamaica and then moved to Miami, Florida, and when I tell people I'm from Miami, they think beaches and sand. And I'm from zip code 33168, and that's close to an area called the Pork and Beans and close to Overtown. And that's not beaches and sand. And I'll tell you, to give you a personal story that kind of encapsulates a lot of everything we've talked about today, is there was one day I was running behind my sister. She was really annoying me, which still happens now, and I'm running behind my sister. And then all of a sudden, I get tunnel vision, bam, out. The next thing I do, I wake up, and there are paramedics, and they're working on me, and they're doing chest compressions. And what had happened is I had had an acute asthma attack related to the mold in the low-income housing that we were in, because we had moved from low-income housing from place to place when we first arrived in Miami. And you know, the one thing I always remember, and I've told this story to a lot of colleagues who are close to me, is you know, I was just like, God, she got away. In my mind, I'm thinking of my sister. And I look over the paramedics doing all the work, and I see my mom, and my mom's eyes are tearing up. And for those of you who don't know my mom, and I think many of you probably don't, she's the strongest woman in the world. And that's probably one of the few times, not that crying is a bad thing, but one of the few times that I've seen my mom that emotional. That's inspired me always, almost every day when I think about this kind of stuff. And so I want to kind of make 3 points based on kind of my own life experiences. Firstly, you mentioned it, and I'm going to take a leaf from your comment. There's tremendous strength in communities. What my mom did for us was she taught us about education and the kinds of things that would help us advance. And so understanding that there's strength in communities. 2, and I'm pretty serious about this, I don't mean to be critical. Earlier on in this conversation, I heard us say the words those and them. That is us, right? So there is no them and us, because I am them, much like we all are, because there's no difference between me and you. Much the same way when you pass and go up past people who are from Roxbury, Mattapan, all these kind of neighborhoods around here that are like zip code 33168, they are you and you are them. So removing that differentiation is important, because it's always easy to think about the them when we want to be critical and come up with other ideas. The third thing I would say is one of the things we talked about earlier was this idea about how do we get them out of those environments. A lot of people in local communities like where they live. When I go back, my people are there. And I'll tell you that a lot of my folks don't want to leave. It is not that they don't like where they live, but they understand where they live. That's home. Just like your home is your home, that's their home. And so the idea of building up communities is what's important for me, and I think what's important for us.
Yep.
We have, from my perspective as a funder, we've really been focused on that. So we have worked with a number of local communities. We've built about healthy food options close to or in walking distance of 1.5 million individuals, revamped local spaces that give 527,000 people access to places to walk and bike. And the point here is to really take a leaf out of what you just said, is there is strength in local communities. And we need to build up local communities and understand that the people there, some of them are smarter than us. And they understand the issues and the challenges more, and we need to rely on them. Last point I will kind of make as we kind of think this through.
As we slide into Slido, so we're expecting lots of questions.
That's right. Questions for everybody else but me. I'm just kidding. The last point I'll kind of make on this, about this kind of differentiation and then how we think about what we do next. Part of the challenge we have is that we don't recognize first the strength and the capabilities and the solutions in local communities. We worked with a group of pastors in North Carolina, and they have transformed this issue of healthy dieting and exercise in a way that I'm a cardiologist, I could never think about that stuff. And that's because they understand that. So when you think about these social determinants of health, which you've heard this terminology over and over again, when you hear all of these academic words that you all are very smart people, that you use them, just remember that the people behind them are me and us.
Those are wonderful points. Thank you. Great. So diagnosis tools. So Rebecca Weber asks, when people are homeless, you've all worked on the idea of homelessness and access. How do you push policy that can lead to concrete diagnosis tools? For example, the level of schizophrenia among the homeless populations. Is it finding them and offering rides? Is it trying to get them safe housing?
Yeah, I can comment, from the ride perspective, we've seen more and more, actually, schizophrenics, other mental health issues, that they wouldn't call for the local transportation service because it wouldn't show up, or it would be 3 hours late, and they didn't want to take public transit because they knew everybody there and they didn't want them to know they were going to these programs, right? And so when you can get reliable, convenient transportation and you can get them access to their programs, we've proven that adherence rates for a lot of these programs increase by over 50%.
I would say homelessness is one of the things in housing that's, I think, mobilizes people to be thinking about us, not just you or they over there. My 5-year-old, we drive around Washington, D.C., where we live, and she'll say, why are people sleeping under the bridge, right? Yeah. So that sense of horror that you see when you see so many shanty towns in cities around this country because the cost of housing is so high and because of mental illness, diagnosed or undiagnosed. There are solutions that work. So I can't speak to the diagnosis, the medical side, but from the housing side, providing stable housing, permanent supportive housing with services, including mental health services, really does stabilize, and that's what we need to mobilize to be able to do consistently in communities to address those kinds of issues.
And in fact, it occurs to me that two of you are doing kind of community level interventions, whereas ride sharing is something that a person immediately can access. So in a sense, you're changing the conditions and you're making individual services possible. And I wonder, Garth, do you tend to favor, when you're looking at proposals, things that are at the community level and people can take advantage of them or not because it's improving, or lots of outreach of the kind of direct services?
Yeah, the first thing I look for is engagement, meaning how much is what you're saying reflective of what's needed and what the folks within those local communities actually want to do. So if you bring something to us that is academic in nature but divorced of the community, that lowers our interest. If you bring the opposite.
Those are very cutting words to those of us who work in academia as well as media.
But if you bring something that has genuine community engagement all the way through, then that shows that you're interested in impact, and I think that's the bottom line where we are as well.
Can I jump in?
Of course.
Sure. Yeah, I just want to build on that. I mean, the field has really moved to understand that it's a group of individuals, sometimes called a coalition, or a group of leaders who need to work together over a long period of time, and we need to help them with their knowledge, engagement, and social networks, because the diffusion of what they're trying to do throughout the community is what's key, and all this is measurable with social network analysis and system science. So there's a lot of sophistication now to this community engagement that a lot of people think is a little bit soft. There's a tremendous amount of quantitative, complex modeling going on to understand it better so that we can export that to other communities to do the same work, because it's all of the people up here and others working together in a community to make sure an individual is benefiting from all of it.
You know, and that's such a good point, and I wonder if, Garth, you want to talk about this, which is, Chris makes the point that all of us, I think, feel now, which is try to catalyze community activity and activism and intervention, because that's where potency lies. But Garth, do you find that once you find a successful approach in a community, because you have looked for what is real, will have impact, and then you find that it works, is it transferable? Are there models the way Chris was working to bring shape up to other communities?
Yeah, you know, I think that's been my lifelong challenge, is both transferability and scalability.
Yeah.
You know, what are the components of something that's been done successfully that is genuinely scalable? I'll tell you that the thing I have learned, both from my own personal and professional life, is it's the premises that are scalable, maybe not the exact strategies.
Right.
And one of the concepts of premises that I think is particularly scalable, and is going to be repetitive because I'm hoping that folks remember this, is that the solutions are there. Just like what you've done in Somerville, the solutions were there. And so it's about empowering and bringing people out. And I think that's one of the kind of 10,000-foot things that we need to do. Listen, when Jack Geiger started the Community Health Center movement, one of the things, he and others, you know, one of the things they did when they started bringing together these boards was just that concept. And so Jack, who is a mentor to many of us, at least virtually, because of what he's done, I think is an example of the fact that, again, you can pull that to scale and create broad-scale impact across the board.
Yeah.
Wonderful. Last word on community transferability.
I think just to build on that, the what, the solutions, the evidence-based strategies are fairly clear now in a lot of areas. It's the how. And what I was trying to describe before, and I think, Garth, what you picked up on, is this adaptation that needs to happen, the customization, the how it gets implemented in the local context. And that's what's tough to do, but critical to success.
Great. Well, those are perfect last words for a great panel. I thank the Atlantic for bringing us all together today, and you for being here.